So I welcome Madhuri for today's presentation. Uh, Before that, I will shortly introduce her. Uh, Today, she is presenting on the topic clinical and neuroimaging association between neuropsychiatric symptoms and nutritional status across the Alzheimer's disease continuum and longitudinal cohort study. Madhuri holds a bachelor's degree in microbiology from Ramlal Anand College, University of Delhi, and in the final semesters of our master program in nutrition biology at the Central University of Haryana. Her academic journey has honed her expertise in microbiological techniques, food quality analysis, and core principles of nutrition science. Through this fellowship, she is looking forward to acquire advanced scientific and research qualities, which will help expand her knowledge base and empower her to contribute to high impact scholarly publications as well as aid in thesis writing. I welcome Madhuri to start her presentation. Madhuri, please continue.
Thank you for the warm introduction. So, my topic, as already told, clinical and neuroimaging association between neuropsychiatric symptom and nutritional status across Alzheimer disease. So basically, what already the studies have stated that malnutrition is directly or indirectly is very much related to Alzheimer's disease. And Alzheimer disease, we know that it occurs as the last stage of cognitive decline that is usually common nowadays in the patient who are already experiencing cognitive related problem in their early stage of old age or due to aging and other related issues, dementia, and all this ultimately causes Alzheimer disease. So other thing that people have already also have said that what happens is that once the person get across with Alzheimer disease, they tend to experience more malnutrition. So this becomes a vicious cycle that malnutrition, they tend to eat less, and their taste is also, they forget to eat, or their taste bud also acts up. So all of this reason further elevates the cognitive decline. So, while many studies have already explored the link between cognition and nutrition, the relation between neuropsychiatric symptoms, the basic symptoms, which mainly include depression and hallucination related agitation, anxiety, these type of symptoms, and the relation with their nutrition and the food they eat is often being overlooked. So it is unknown whether malnutrition is a consequence of NPS in case of Alzheimer disease, or if both share some common neurological mechanism. So this is a flowchart which basically gives the main overlook of how the paper will progress, that malnutrition is directly linked with cognitive decline, and there are many neuropsychiatric symptoms which are not being studied yet, are also directly related to Alzheimer disease, as well as it is being termed as amnestic mild cognitive impairment, or AMCI. So literature review, what it has said is that one observational studies have showed that there is risk of malnutrition which increases during in case of Alzheimer and positively associated with cognitive impairment in 2018 paper. And there are many papers which has shown that association between cognition and nutrition, but it has often overlooked NPS, an important and prevalent group of non-cognitive symptom clusters. And and in its relationship with nutrition. And there is a particular longitudinal studies which have stated that there are in case of NPS there are worse nutritional status with severe NPS and included psychosis, depression, and apathy in case of dementia in the patients with the dementia. Despite accumulating this evidence, previous studies have either included only women and various type of dementia. So this is kind of a it is like it is a shortcoming of those paper that they have included only women as their study population or various type of dementia. So how this paper have progressed is that study design was that they have taken patients with AD continuum at baseline, which included amnestic MCI and AD dementia, which were taken from Chinese imaging biomarker and lifestyle CIBL study between June 1, 2021 to December 31st, 2022. And the inclusion criteria was patient which are aged between 50 to 90 years, and in case of Alzheimer the onset should start from more than 60 years, and the diagnostic criteria should be met of the Alzheimer's as well as in case of amnestic MCI. And the total 432 participants were taken, out of which 165 participants showed the good follow-up result of around 10 months and more than 10 months. How the data collection progress is that they took anthropometric test and data and clinical history, which is related to sex, their eating habit, everything related to that. And neuropsychiatric inventory tests were done. Brain imaging was done using pseudo-continuous atrial spin labeling to analyze cerebral blood flow in nutrition-related brain region. And there are other comprehensive neuropsychological tests which were fulfilled using questionnaires. And statistical analysis were done by categorical variables as presented as proportion and were compared using chi-square test, whereas continuous variable are presented as mean standard deviation, generalized linear mixed models to examine the association between the baseline and the change in nutritional status. So basically, the paper wants to study that are is this theory that malnutrition is related to Alzheimer, is it correctly they are related, or it is positively associated or not? So this paper has showed a very good result, is that baseline NPS predict malnutrition. So general NPS, particularly affective symptoms, which are because this paper is particularly working on the neuropsychiatric symptom. So it is not related to Alzheimer or dementia, rather the symptoms. So how those symptoms are being positively affected due to eating habit, or what type of nutrition the person is being taking. So yes, it is particularly affected by that. And strong predictors, they are shown, appetite is being shown as a strong predictor of declining this nutritional status. And depression, anxiety, these were directly affected. And the patient with these symptoms had significantly lower scores over time. So what was the brain imaging inside? So basically it was showing that there was a high level of cerebral blood flow in the left putamen, which is a part of the brain which is associated with malnutrition, and general NPS, affective symptoms, and other hyperactivity related symptoms were affected. And other than that, the brain region like the right putamen and anterior cingulate cortex were also linked to NPS. So this figure shows here, this is the forest plot here, and we can see that the different brain images in the left hand side, it has been shown that yes, left insula, left amygdala, so how that they are positively or negatively related to the nutritional status, general NPS, psychotic symptoms, affective symptom, hyperactivity, and appetite eating disorders. So positive effect, which is P more than less than 0.05, which is showing a significant result, which is more in case of putanium, if I'm saying it correctly, putamen. Oh yes, putamen. So that is showing a very positive result. So hypothalamus, VTA, putamen is here. Left putamen, right putamen, and left candidate nucleus, amygdala. So these relationships were checked. Other than that, what were the longitudinal findings? Were that the severity of affective symptoms and appetite eating disorders correlated with a greater decline in case of nutritional status. And patients with these symptoms at baseline had higher odds of malnutrition during the follow-up results. So, what is the potential neurobase? If we check the neural mechanism of it, is that the putamen may serve as a shared regulatory brain region, influencing both the NPS and malnutrition. So, if we, as we started the studying, is there any common ground in which the NPS, that is the neuropsychotic symptoms, and malnutrition, do they share some common neuro related part? And that is positively said by the paper, is that yes, the putamen may serve as a shared regulatory brain region, and dopaminergic symptom involved in motivation and reward processing might play a role in both emotional symptoms and the feeding behavior, because we know how our emotions are being affected directly or indirectly in the food we eat. So like if we are in a good mood, then we tend to eat more, or we tend to eat more of the sweet try to eat. So yes, those are also related to. So in case of cognitive decline, this might be affecting the emotional symptoms and the feeding behavior as well. So this was not correctly defined, but yes, those symptoms were also said in the paper, that what are the different effect is being shown. Okay, so in this paper, in this result, basically graph, forest plot, uh, different history, sex, onset, these variables are being checked, and on the basis of that, it is being the characteristic being plotted, that how it is affecting that. Oh yes, here it is basically I have not mentioned it correctly, but it was shown that malnutritional individual show basically the female who were older, predominantly female, and had a history of diabetes mellitus, were showing a lot of those symptoms of NPS regarding symptoms, the neuropsychotic symptoms, as compared to the well-nourished patient. So this is a significant relationship, the psychotic symptoms in case of that. And this forest plot I have already defined what it is saying, stating appetite, hyperactivity, and the So, how I would conclude this paper is that neuropsychiatric symptoms, nutritional disorders, and appetite eating issues, this significantly impact the nutritional decline in patients with Alzheimer disease and other cognitive decline. So, the symptoms tend to start from the early stages of dementia, the starting stage only. So, we can somewhere or the other change the nutrition that can affect the Alzheimer disease. So this can be a approach towards treating Alzheimer disease. Basically, the putamen could be a common neural pathway linking NPS and malnutrition. And early identification and intervention for NPS may help prevent the worsening malnutrition in AD patients, because we know Alzheimer's, as the Alzheimer's starts to happen, Alzheimer's stage 1, stage 2, so the malnutrition also tends to keep worsening. So if we start to earlier identify those problems, so there can be chances of rather not showing the worst symptoms. So implication, yes, there can be a very good implication in case of healthcare and the medications which are provided for in case of preventing the symptoms of Alzheimer's. So healthcare providers should closely monitor nutritional status in case of patient with neuropsychotic symptoms, and intervention targeting the NPS, especially affective symptoms and eating disorders, they mitigate malnutrition risk. So those interventions should be they should be kept in mind of the all these factors which are being stated through this paper. And yes, there should be future research which can investigate this particular topic in more detail, so that there can be more help for the future generation and the patients which are starting off with this Alzheimer problem, so that there can be more intervention development. We can also create some medication on the basis of keeping this in mind to address both the psychological and nutritional health in Alzheimer disease. So this is the reference of the paper. Thank you so much.
Thank you, Madhuri, for your wonderful presentation. Now the floor is open for Q&A session. Please type your question in chat box if you have any doubt. I see no questions in the chat box, so we can conclude. Once again, thank you, Madhuri, for your presentation, and I thank you everyone for attending this presentation.